Exercise is hard for people with burn injury for a couple of different reasons. For one, I think the psychological effects of the injury can make it so people are feeling down or depressed, or maybe hesitant to get out in public, and their sense of their body image, and facing strangers. We know this is a challenge for a lot of people. Some other consequences of people's burn injury we know are also um, factors that might make it challenging for them to engage in an exercise program. Um, these consequences can be things like pain or itch, which are both very common complications of burn injury. We know that itch is close to being ubiquitous in burn survivors, even years after their injury. And pain and itch are obviously consequences that make it you feel uncomfortable maybe when you exercise. The itch can be exacerbated by being hot and sweaty, and pain with different movements of your body, and so finding ways to make people comfortable enough that they're um, able to engage in the exercise is an important part of uh, the clinician helping their patient find exercise that works for them. And sometimes exercise involves going to the gym or being in the public, wearing shorts and a t-shirt at the gym when you have burn scars and things that, you might not feel entirely comfortable with other people staring at you, and how other people engage you. Um, so I think that's a part of why exercise can be a challenge. The other is that, to engage in an exercise or wellness regimen involves a little bit of motivation, some organization, having the right resources and knowing where to go to get these sort of interventions and how to access them. And sometimes that involves someone else helping you and guiding you in those choices. And those choices aren't exactly cookie cutter. So, what might be a great exercise intervention for one person might not appeal to somebody else. And so it's in our job as clinicians to help people find the right exercise interventions for them. And there's, such a wide variety of different activities that can meet this exercise criteria, that, I feel pretty confident that if we get to know our patients well and really work with them to help find the right interventions for them, there are lots of options.